I don't think you can talk about healthcare without talking about finances these days.
The vast majority of bankruptcies in this country have something to do with healthcare costs. So if we are going to want to help Americans build and preserve any sort of wealth, we have to focus on their health.
Even if we were to help bring transparency and reduce the errors, if you look at the way healthcare costs have inflated relative to savings rate and wage growth, the fact remains that healthcare is still way too expensive.
Now there's an opportunity for us to finally do a deeper dive into the social determinants of health. Because from my perspective, these communities are vulnerable and we have poor health outcomes because of poverty. And I'll just be bold and say poverty kills.
It's really crucial for employers to remember how humans work, right? When you're in a crisis, your brain actually can't think the same way that it does when you're not. So you can't even remember what you have access to when you're trying to manage through that particular issue. You need to have the ability to drive that into the face of the person who needs it when it's relevant for them.
Financial health it's not a one-size-fits-all model. It isn't a specific number. It's about how each person defines financial security and having the financial freedom to make positive choices in their demographic, social, and economic circumstances.
So if we know that to be true, what are we doing as a city, as a state, as a country to get at the economic and educational factors that are causing the type of health disparities that we're seeing now?
What money is lost in a community when there are certain individuals that are not counted in that community?
And as we're thinking about the recovery, we have to be thinking about how that recovery is done in an equitable way. We want to make sure that we're supporting people who are mostly impacted by the pandemic.
I'm really looking forward to us going deeper. We have not changed it yet, and nor will we change systemic and structural racism with philanthropic dollars. It is going to take a multi-sectored approach, but I'm enthusiastic about the path that we can be on when we're really willing to face the reality of where we've come to this moment and who has been privileged to get here and who was not.
This is the time to get us all moving towards equity, towards social justice, and I'm hoping that everybody will be in this together.